Drugs are all around us, and we always hear about different drugs that are circulating in society. It is important to be aware of the different types of drugs and the effect that they have on our bodies in order to understand the danger that surrounds them. There are four main types of drugs. These are stimulants, opioids, depressants, and hallucinogens. Stimulant drugs include cocaine, caffeine, ecstasy, and nicotine, and they speed up the function of the central nervous system, causing increased energy, high blood pressure, and increased heart rate. Depressant drugs include alcohol, Xanax, and Valium, and they inhibit function of the central nervous system, causing drowsiness, confusion, and a lack of alertness. Opioids are drugs found in the opium poppy plant and include drugs like heroin, codeine, and morphine. These drugs relieve pain but are highly addictive. And hallucinogens are drugs that alter a person's awareness of their surroundings, and examples include marijuana, LSD, and DMT. These drugs can cause hallucinations, paranoia, and can induce psychosis when consumed in high quantities. Even though these drugs are all different and affect the body in different ways, most of the drugs that cause addiction and dependence have something in common. They trigger the release of dopamine in the brain, which encourages the drug or alcohol user to repeat the activity, increasing the risk of addiction. Addiction is a disease of the brain, and it occurs when prolonged drug and alcohol use changes the way the brain functions. It is important to stop drug and alcohol abuse before addiction develops, because addiction is not a disease that can be cured completely, and it requires lifelong treatment. Unfortunately, there are many factors that hinder progress when treating drug and alcohol addiction. One of these factors is the stigma that people affected by addiction have to face. Stigma occurs when there is a set of negative beliefs, attitudes, and behaviour towards a certain group of their life choices or life situation. Examples of stigma are talking about drug dependency or addiction like it is a choice, stereotyping, judging, and discriminating against others who take drugs. Stigma fuels addiction because it can lead people to hide their addiction due to guilt and shame. It affects a person's ability to find a job and housing, and stops people from getting help because they are afraid of the judgment they will be faced with. Addiction is a complex medical issue, and no one chooses to become addicted. It is important that we treat addiction like any other illness and stop blaming people for their addictions. If we all work together, we can all help reduce stigma surrounding substance abuse disorders. Addiction deserves just as much care as any other medical condition, and if we all take steps to show respect and compassion to those who are struggling with drugs, we can help and encourage them to seek out treatment. Thank you for watching our video on prevalent problems today. If you would like to find out more about the DATE project, have a look at our Facebook page.